So what is motivational interviewing? We've been hearing a lot about it. It seems that every time I pick up a journal or a magazine, I hear about motivational interviewing. For those that aren't as familiar with MI, can you describe it for me and maybe touch on the spirit of motivational interviewing?
Sure, and as I mentioned earlier, it was an approach that was developed in the 70s by Bill Miller and Steve Rolnick to address the population in addictions. And it has spread now to multiple settings for use with multiple issues and populations. And I like to describe it as a client-centered approach that is goal-oriented, and you're working with a patient to help pull out their ambivalence and help increase their intrinsic motivation to make some difficult lifestyle changes. And when we talk about the spirit of MI, what we mean there is that this isn't just a technique. It's not something that you're doing to someone. It really is an entire paradigm shift. It is looking at my role as not the expert or someone that's directing, but it's actually placing myself as a healthcare provider in more of a guiding role. And it's putting the spotlight on the patient. It's the patient that's going to have the solutions to take this information that they've been given 20 times and make it fit into their life. So the spirit of this is more of a philosophy, it's more of an approach, and it's totally taking what healthcare has traditionally done and making a 180 shift.
And in all fairness, there are many different approaches to motivational interviewing. When we talk about motivational interviewing, it came out of the counseling field, the field of clinical psychology, where it was used with addictions by mental health care professionals that typically work with clients in 45-minute increments. And we're talking about your interests and my interests, and what we've been doing in our work together is really focused on brief motivational interviewing, the kind of motivational interviewing that has been evaluated in research studies, the kind of motivational interviewing that's been used with patients with chronic diseases. And that is really a practical approach that can be used by healthcare professionals.
Yes, and it wouldn't make sense to expect healthcare providers first to be counselors and second to expect to have the luxury of 30 minutes or 45 minutes. So this truly is an approach and application that can be used and is appropriate to use in very brief interventions, even those of 2 to 3 minutes.
So for example, one of the models that we've been using in our work with primary care and healthcare systems is building competencies, those core competencies around understanding resistance, about how to engage, how not to evoke resistance, and reduce perhaps the chances of change. And we find that nurses are often key people or health educators in playing the core role in spending some more time with patients, but physicians and pharmacists and others will have briefer interactions, but will be applying those same principles, not in the same detail. We're trying to delegate here, but we'll be reinforcing them, because if they're not reinforcing them, then we can evoke resistance, or we don't have everybody aligned as a team.
Yes, that is going to be important, that you have a team that does philosophically understand the behavior change science and the approach, and even though they don't all have the same level of proficiency, at least we have folks that are at the competency level of doing no harm.